Hello, everyone, and welcome back to Youthful Medicine. I am Dr. Tahir, a board certified rheumatologist and an obesity medicine specialist. Today, I would like to talk to you about a wonderful patient of mine who has been on her weight loss journey and she is doing tremendously well. Um, she, so my this patient, she is about 46 years old and back in February of 2024, she started with weight loss journey with me. And after initial evaluation, of course, checking her BMI, making sure there's no contraindications, and that she has the requirements for us to get the FDA approved medications for her, we basically started the journey. At that time, her weight was um, with a BMI. Her weight um, was 281 and her BMI was 32.6. She had told me that she was planning to be, you know, she was planning to lose weight for a target, and the target was her son's wedding, which is this month. And we had planned to see that, okay, let's see how we can achieve that. And our target goal was 40 pounds. And today she did achieve that. And I'm very happy for her. I'm celebrating that with you all too. So her BMI is now 25. She's looking forward to attending her son's wedding. She's happy. She can fit in the clothes she wanted. However, there's one concern that she raised, and I thought that was an interesting point that I should talk to you guys about, which you may also relate to, which is loose skin after significant weight loss. We will dive into the strategies that can help. So before we uh, we go into the surgical or other cosmetic options, which I will briefly talk about, I want to talk about lifestyle changes. So think of this patient. Let's go back. So a weight loss journey that started February, so about 8 months ago. And we are looking at this lady who has lost about 40 pounds, about 5 pounds average a monthly weight month per month weight loss, which I usually recommend my patients. And she is at a BMI of 25 now. So over the past 6 months, through the dedication of her treatment and her healthy habits, she's now lost more than 40 pounds and she's achieved her goal. Zepbound, which was the prescription that I gave her, has played a significant role in her weight loss journey to help control her appetite, to reduce the cravings, and improve her metabolic health. So, what happens when we lose weight? We lose muscle and fat both. And in this case, obviously, one third is muscle, two-thirds is fat. That's roughly the estimated what the research studies have shown that people lose weight. So, in this patient, I believe that there is some loosening of the skin because of the loss of muscle and mass, and this is something that I've heard from other people as well. So how we can address it? Well, let's break it down into few strategies that we can talk about managing loose skin. First of all, and most important thing that I think we should all be talking about when we start losing weight is strength training. The first thing we discussed was that we need to increase the muscle mass through strength training. When you lose weight, you lose both fat and muscle. Strength training helps build muscle and replace that space with muscle, filling out some of the loose skin and giving your body a more toned appearance. Number two, we have to also think about collagen and skin elasticity. We also discussed today with her about how collagen peptides and protein diet can help improve the skin elasticity, and incorporating collagen rich foods and supplements can help improve firm her skin over time, obviously. Hydration and skincare. So hydration is crucial, both drinking plenty of water and keeping the skin moisturized to maintain its elasticity. Then we have some body contouring options. In some cases, patients may explore body contouring procedures, but I always recommend focusing on the natural methods first, like fitness and nutrition, before considering any surgical options. So that's a quick summary of things that we discussed. But overall, this patient is doing great, and I'm very confident she will be able to achieve the goals and improve the skin loosening with replacing with better elasticity, with muscle building and strength training. So in some options are what they call the surgical body contouring options. So there is something called tummy tuck or abdominoplasty. This surgery removes the excessive skin and fat from the abdominal areas while tightening the underlying muscles. It is ideal for those who with significant sagging in the midsection after the weight loss. The second is called body lift. It's a belt lipectomy or circumferential tummy tuck, and a more comprehensive procedure that removes the excess skin and fat around the entire midsection, abdomen, your flanks, and your lower back. This is often recommended for patients who have undergone massive weight loss. Then there's something called arm lift. So it's called brachioplasty. It is where there's some procedure that addresses the loose skin under your upper arms, commonly referred to as bat wings. Excessive skin is removed and the underlying tissue is uh, tightened. Then there is something called thigh lift, which is the thigh lift targets the sagging the skin in the inner and the outer thighs, providing a more toned appearance by removing the excessive skin and reshaping the leg contour. There's something called breast lifts, mastopexy, for those experiencing sagging breasts. After weight loss, a breast lift can remove the excess skin and raise the position of the breast. It can be combined with augmentation if volume is also a concern. There's something called face and neck lift for patients with loose skin in the face and in the neck area. A facelift or a neck lift can tighten and smooth out the skin. There are some non-surgical body contouring options too, which is one of them is called radiofrequency treatments like thermage or venous freeze. So these radiofrequency treatments use radiofrequency energy to heat the skin, encouraging collagen production and skin tightening over time. These treatments are non-invasive and they have little to no downtime. Laser skin tightening like laser lipo or alt therapy. So these laser-based therapies, they are useful using ultrasound and laser technology to um, target the deep tissue layers of the skin and promote collagen production and improve skin firmness. There's another procedure you might have heard. It's called cool sculpting. Although primarily a fat reduction procedure, cool sculpting can help improve skin appearance by elimination of small areas of stubborn fat that remains after weight loss. And if you have facial or other areas of skin loosening, you could try micro needling and radiofrequency procedures that can help tighten the skin around the face and the forehead area and the chin area. Body contouring creams are also there. They're not really that helpful, but they can be tried in some cases, might be useful. And there's something called electromagnetic muscle stimulation. So this is like devices called M-Sculpt. They use electromagnetic pulses to stimulate the muscle contractions to help build the muscle and improve skin tightness in areas like abdomen, buttocks, and thighs. And I've seen some of these med spas using it. But obviously, it is better to use like the real exercise because that has also benefits on your cardiovascular system. So these combination of treatments exist for patients who have loose skins. So I thought it's an interesting topic, share with you guys. If you like my channel, if you like the videos that I produce, please give it a thumbs up, like it, share it, subscribe it, and I will see you in the next video. Take care.